Hey, you know I'm back because I work hard and I play hard. So after this video, me and my grandson are going to the game. You know, the one that was mad because he couldn't say what the fuck. Well, he's 10 now and he's a basketball fiend, so we're going to the game. But for you, my love, right now, we're about to do this video on delegation and assignments. It's really hard to figure this out for a lot of us, right? So we want to give you a great video on this information. But remember, when we talk about delegation and assignments, one of the problems is it's different per state. I live in Ohio. This information that I'm giving you this morning is really based on Ohio. Hello, that's where I live. Specific information about your state, you're going to have to kind of keep yourself up to date on. But in general, this will help every single nurse, no matter where you live. But in specifics, in terms of actual task, this will be Ohio-based, Ohio law based, okay? Now, when we start thinking about delegation and assignments, we are thinking first about the 5 rights of delegation, that it doesn't matter where you are and who you are, this is what we go by to make sure we're delegating appropriately. So what are the 5 rights of delegation? Because it just sounds like it would be like a select all, you know how that is. So what is it? Here we go. 5 rights of delegation: the right task, the right circumstance, the right person, the right direction, which is based on the communication, and the right supervision. The first one is super important because the right task is, guess what? Based on your state law and your facility guidelines. In my state of Ohio, I'm going to give you all the different things that you can delegate to an unlicensed assistive personnel. And if you're taking an NCLEX in Ohio, you might want to write this down. Here we go. State law, Ohio, where I live, we as nurses, LPNs and RNs, can delegate to unlicensed assistive personnel, and the tasks that I put on the board are the ones that sometimes are controversial and nurses getting a big like, no they can't, yes they can, no they can't do it, yes they can do it, well at my hospital we do it, and at my hospital we don't do it. Okay, so we're gonna give you the law because your girl researches the law. That's what a PhD is all about: facts, evidence, research, peer-reviewed, law-based, ethical. So here we go. The nurses in Ohio can delegate enemas, vaginal and rectal suppositories. I hope your little ass is taking notes, and hit the subscribe while you at it. Topicals, ointments, creams, eye drops, ear drops, nasal meds. Oh yeah, it's true. They can, unlicensed assistive personnel, UAPs, can by Ohio state law administer, once again, enemas, vaginal and rectal suppositories, topical creams, ointments, eye and ear drops, and nasal meds. Wow, I'm almost positive you didn't know that. So what we have to remember is a lot of state laws changed after COVID, during COVID, to allow the maximal use of your license. If an RN is spending time doing mundane things that she could have delegated, of course she's going to lose her mind, and the patient's not going to get great care because yours truly can't do it all, okay? So I really want you to take good notes here if you're taking an Ohio test. All right, here we go. Now, by the way, even if you're not taking an Ohio test, this It's pretty much true for a lot of states. So it's like the majority of states do this, okay? So here we go, more love. What else can the unlicensed assistive personnel do? They can remove the IV in preparation for the patient to go home. They can remove the Foley in preparation for the patient to go home. They can get stool and urine cultures. They cannot get the urine culture from the Foley catheter, but every other urine culture they can collect and send off. They can take care of I's and O's. They can do 3 things that I want you to remember and maybe write down. Okay, so they can record I's and O's. Report, record, and remind are the 3 R's for the UAP. I'm going to say that again. Report, record, and remind. So they can report I's and O's. They can report pulse oxes. They can report anything abnormal to the nurse. They can record I's and O's. They can record your what is it that I wanted to say about the record? Oh, your pulse ox, the vitals, everything, record in Epic or wherever, right? And so remind, they can remind the patient to use the incentive spirometer. They can't teach it. They can remind the patient to turn every 2 hours. They can remind the patient of several things, but they cannot teach. All right, now let's look at more things that the UAP can do, because we're looking right now at the right task. The UAP can do bladder scans, EKGs, telemonitoring too, put that in there, CPR, hello, AccuChecks. You kind of knew that, didn't you? Yeah, so there's a lot of tasks that I know everybody was confused about, and I just thought, let's just settle the score, look the law up, do my research like a real good PhD prepared nurse would, and offer you the most updated information. Okay? Now, here's some nevers, because just like that information I just gave you was based on state law for Ohio, here's some nevers that probably apply to every state. And these are some nevers that sadly I have heard out there in the community somewhere, somebody's allowing a UAP to do, which should be reported to the Board of Nursing because it's outright unsafe. Just saying. So here we go. Never enteral feedings. Never. And that means NG, PEG, whatever. Never. Never Foley insertion. Never. It's a sterile procedure, okay? So never. Never sterile procedures and insulin injections. I can't tell you how many students have told me that at their facility, some asshole allowed a nursing assistant in the place or group home to give insulin. That makes me want to lose my mind because that is the most unsafe. I mean, come on. Insulin is a high alert drug. Half the time RNs and LPNs are giving it wrong, doing it wrong, making a mistake, getting an error in insulin because it's kind of like a big deal. And you're going to let an aide give an insulin injection. I'm sorry, just a little bit hot about that. I'm going to try to refocus. Dressing changes. No. No. Dressing changes are not to be delegated to the UAP. IV, IM, PO medications, unless you are a medication aide that is certified by the state of Ohio. If you're not a certified medication aide, you have no business giving IV, IM, PO meds. And even the certified medication aide can't give anything IM or IV. Remember that a tricky area on your NCLEX or your HESI exam is the initial. They use that word a lot, and I teach my students vocabulary matters. So if you see the word initial, get the initial weight on the new admission. Ambulate, do the initial ambulation after surgery. Do the initial feed for the stroke patient. Ha, hell no. No, we're not doing no initials around here, because initial means it's the very first time it's being done, and that is not a good idea for the UAP. So no initial anything, all right? No feeds at all on dysphagia patients. And if you're like me, maybe you confuse the word dysphagia with dysphagia. The dysphagia with the G means they can gag. Dysphagia with an S means S for speech. They can't speak, or they have difficulty swallowing or speaking. Speaking. Hello, speaking. So dysphagia with an S is speaking. Dysphagia with the G is the whole gag swallow thing. Hope that helps, because speech pathology determines, you know, if the patient is going to have trouble swallowing and if they can eat and all that good stuff. And so if they decide that the patient can eat, sorry, but the RN has to do that feed, okay? That initial feed. Now, let's do some more, shall we? Right circumstance is important, because when you think of the right circumstance, yes, the UAP can do AccuChecks, but not on my DKA patient who was in a coma. Does that make sense? They're not stable. And you know the rules. You only delegate stable patients. So doing an AccuCheck on the DKA who came out of a coma and now is on an insulin drip and all this stuff, no, that's not the right circumstance. You see what I mean? Okay. Right person. Well, let's look at that. I have a delightful student in my class that I encouraged her to apply to my old unit, and she got the job. And so when I was working with her, and that was a pleasure, when I was working with her, because she was really good, but when I was working with her at the facility at the hospital, and again, she was really good. Shout out to my girl, D. When I was working with her, I was asking her to make sure that the tele monitor was on a patient, make sure you change the batteries, and she had just started. And because I know she had just started, which is why right person matters. Did they just start? Do they not know how to do some of this stuff? Do they is this their first day or first week? I wanted to make sure that she knew how to do these things. So I said to her, have you ever put the tele leads on before? I can teach you. And she had never put the tele leads on before. So we went to go have fun and learn how to put tele leads on. So delegating to the right person, yes, it's in her scope to put the telemetry leads on the patient and get them started on their telemetry or EKG, but it may not be the right person because she's never done it. So you have to do it with them, make sure they can really do it. I find this to be true with emptying Jackson Pratt drains or hemovacs or emptying a colostomy. You really have to make sure they've done this before. If they haven't, show them what a team player you are. Go in the room with them. Don't just say, well, go find an aide who can teach you. Oh, that's ugly. Right direction and communication. So every day that I work on this one unit, which is a med-surg nursing floor, I find out who my aides are. I love on them, say please and thank you, make sure that, you know, we got this. And they know they can call me for anything, right? So when I do that, I also make sure that I tell I delegate to the nursing assistants, and our floor is called PCNAs. So I delegate to the PCNA the tele battery changes that needs to occur in the change of shift time frame. So when we start at 7 o'clock in the morning, I'm asking that by 8 o'clock, these tele batteries have been changed. So look at this. Right direction or communication. It's not enough to say, hey guys, can you make sure you change all the tele batteries? No. Hey guys, I want to share with you that room 8, room 12, room 14, all are on telly. And I want to make sure I check back with you by 8 o'clock that the telly batteries were changed. This is a high priority item, kind of like when you go in there and do your vital signs and your AccuCheck, throw that battery in there, put some batteries in your pocket, and let's do this. Let me know. I'll check back with you at 8 o'clock. Correct or right direction and communication. Be really precise. When do you want it? How do you want it? Okay. Right supervision. That overlaps a little bit, but here's what we really mean by right supervision. You may delegate a task to an aide and you may say incorrectly to another aide, can you go make sure that Sharon did that right? What the fuck? Aides don't supervise aides. They may think they do. Some of them are a little bossy with each other, but they don't. Aides don't supervise aides. Licensed personnel delegate and supervise. So I hope that helps with the 5 rights of delegation. Now let's explore a little bit deeper. Let's go to the LPN because that's a really good one to know. And again, it's determined by state law and your hospital facility. Okay, your guidelines in your hospital or your long-term care or your LTAC or whatever it is. But for the LPN, for the most part, they can do all medications except for IV push meds. They're not titrating drips. They're not doing IV push medications. And they can insert, remove, and irrigate just about anything. So they're really, really beneficial to units that do a lot of procedures. Like the other unit I work on, which is endoscopy, I would have to say that the best nurse on the entire unit is the LPN who trained me, the RN, how to do scopes. Just saying, okay? So data collection, know that term. Know the term data collection. Data collection is on the test, any test, because it takes the place, or let's just say it's another way of saying assessment without saying it. In other words, what really pisses me off about this whole thing is that every single one of you know that RNs, LPNs, and aides be doing a whole lot more than sometimes we know by the books, but we got to go by the books. For example, when we say that the LPN can do data collection, it's almost a slap in the face because the LPNs I know, they can do a lot more sometimes than I can do. And they're very good at teaching. They're very good at assessing. They're very good at all this shit that supposedly they can't do. But you're trying to take a test and pass. So come on, stay with your girl. What they do is data collection. Their data collection adds to the assessment of the RN. Okay, so when they do data collection, not assessments, they are contributing to the assessment of the RN. It's all bullshit. The LPN can reinforce the RN's teaching. What is that? Okay, but it's really important that you know that word reinforce. I swear to God, you got to know that word reinforce. I swear to God, you got to know it. So the LPNs reinforce the RN's teaching. They do not do the initial education or teaching of the patient. Yeah, right. Yeah. Moving on. Textbook. In Ohio, our LPNs can start IVs, give antibiotics through the central lines. They can flush the lines. EKGs. They can do suture removal. They can do almost any procedure at all, like any procedure. One procedure that they cannot do, and this is huge, is blood transfusions. Yes. Can they check the blood? Yes. But can they give the blood? No. Can they do vital signs after the blood has started and the first set of vital signs, the initial set of vital signs have been done? Absolutely. Guess who else can do the vital signs after the initial set of vital signs have been done? Your UAP. What else can this LPN not do? They cannot do anything involving the nursing process. Remember that term? Yeah. Okay, so this is very, very important. So if you've never taken notes during this video, you better get you a utensil of some sort, writing utensil, pen, pencil, marker, crayon, your baby's crayon, whatever, and get to writing. Here we go. Here's the words you gotta know for the test. The LPN, the UAP, neither one can do these. They cannot assess, teach, monitor, advise, recommend, coach, review, evaluate, encourage, or observe. There you go. I'm gonna do those again. The LPN nor the UAP can assess, teach, monitor, advise, recommend, coach, review, evaluate, encourage, or observe. Those are just fancy dancy ways of saying the nursing process. That's not allowed. The LPN cannot, in any state, do IV push meds. It's not a great idea to give them immediate post-ops, which is in the first few hours of surgery. We do not give our LPNs discharges because they can't do discharge teaching. We don't give them admits because that requires a full assessment. They don't do chemo medications. And remember, even for an RN to do chemo, she must be certified to do chemo. We do not delegate to anyone, LPN or UAP, anyone unstable or critical. Some examples of unstable and critical include TURPs, transurethral resection of the prostate, TURPs, pancreatitis, DKA, some good examples, strokes and MIs or CVAs and MIs in the first 48 hours. Yeah, so a good rule of thumb to follow when you're taking your test, be careful when they use hours in the sentence. So if the patient has returned from surgery 2 hours ago, admitted 1 hour ago, had a bilateral knee amputation 2 hours ago. Be careful of the time frames. It's the time frames that get you into trouble with delegation, okay? Now, I want you to remember a little trick. I don't do a lot of tricks because you get them all confused, but never delegate a pie. Never delegate assessment, plan, initial anything, education, and evaluation. A pie. Never delegate a pie, okay? That's it. Never delegate a pie. Now, I'm going to do a really cool video on float nurses and who to delegate to them because you get a million of those questions. I'm also going to do another video in the float nurse video of who to give the new grad, who to give this person to, who not to ever, ever, ever delegate out, you know, that kind of thing. I'll see you in a minute. Deuces.